Hi friends, welcome back to my channel Sharing Simple Knowledge. Today I'm here to discuss about Osce, the first station that is out of 10, that is the assessment. In the assessment planning, implementation and evaluation station, the first comes, it's the assessment. It is a 20-minute station. In this station what we are going to do, from the name itself we know we are going to do an assessment. There are some scenarios they are usually providing: pneumonia, heart failure, dementia, then the neurological observation that is different, then ectopic pregnancy, hernia, so fracture, like that situation scenario they are providing. So for all it's same, but if it's neurological observation, that means you have to assess the Glasgow Coma scale as well. That is the difference, and there will be a separate chart for you for the neurological observation. Including this Glasgow Coma scale, you will document the vital signs, the blood pressure, temperature, heart rate, the pulse rate and respiratory rate in the same chart. But for other assessment, we are using the news chart, that is National Early Warning Score chart. So first we will do the assessment, then we will document it, and we will calculate the score, and accordingly we will inform the patient. According to the score, we will monitor you, how frequently we are monitoring, whether we have to escalate this matter to the doctor, like that. So first of all, including the reading time, you will get the 20 minutes. So we should be specific with the time management. During our practice time, we should be it sets the timer and practice it. So first we will get just read the scenario and understand the situation. Where is the patient? Is in the nursing home, or is it in the emergency department? And the time, especially the time. They were this time 8:30, like that. So you can tell good morning or good afternoon according to the time. And this one you are using for the planning station as well. So for all, even evaluation, you have to use this assessment paper. So should notify the time, because you are while handovering the patient during evaluation, you are telling during my initial assessment this time, like that. So you should monitor the time. So first you have to do the hand hygiene, then assess the safety of the area. So you should make sure the scene is safe to approach. Then you have to introduce, then provide privacy. That's important. You should close the curtain to provide privacy for the patient. And after that introduction, you can tell, I am so and so, I am here to do an assessment for you, like that. Then after that, what you have to do, we should ask them what is their preferred name, what do you prefer to be called, like that. For some, even though their name is and Adam Taylor or something, like they prefer to call Adam, or they Addy, like that. They have their own preference. So we should ask them, what is your preferred name? Then you should ask, is English your preferred language? We should make sure that they know English, or maybe they are using some other language. Okay. Then we should ask also, do you have any hearing or vision problem? We should make sure. Then we have to check their identity. We should ask them the full name and the date of birth. Then we should cross check with their ID badge, the hospital number as well. You should cross check. Then you should look for any allergy. We should ask them, do you have any allergy? Then if they specify they have allergy, we should ask them the reaction as well. You should ask them what reaction they noticed when they had this allergy, or when they took this medication, what reaction they had. That you have to document. Then you should cross check the allergy ID as well. There will be red badge for the allergy, and it will be specified. If it's allergic to paracetamol, it will be written there, paracetamol, like that. Then next you can put maybe there is something they kept on the table, like cigarette or any medication, so we have to ask them. Always gain permission, consent from the patient before you do something. So you should ask them, can I remove and lock it in your locker? Because medications, they can cause overdose if they take it alone, and we are providing from hospital as well, or for the cigarettes, if it's this is a smoke free or smoke free zone, because it's there is a chance for fire, that's why. Yeah, but we should ask permission from them. Then after that, if it's the patient, there may be patient is going for surgery, especially for the ectopic pregnancy and hernia like that, there will be some signage like that, nil by mouth. So, and there is some water on the desk, so we can tell maybe there is a chance you may drink some water, you can complicate like aspiration. So I will remove it, but later on once you start to drink water, I can provide it back, like that we can explain to them. Then after that we have to offer the calling bell. If you need any assistance, you can just use the call bell. Here is the call bell, like that. Then we should ask them, do you know why are you here? What's the reason for admission? Do you know about your diagnosis, like that? Then they will give explanation about the symptoms, why they admitted, and if they don't know the diagnosis, they will tell, I don't know the diagnosis, so we can explain this is the diagnosis. So just give some health education, like that. Next you can move on to the assessment. So we should ask again permission, then do hand hygiene before touching the patient. Then you have to check the airway. Then we can ask them to open their mouth and look for any visual obstructions. But as long as the patient is talking to you, you can even tell that during our conversation, you can say you are communicating well. That means there are no obstruction in your vocal cord. Next is the breathing pattern. So we can ask them to keep one hand on the chest and explain to them, I will count the respiratory rate, the rise and fall of the chest, like that, for full 1 minute. You should count for full 1 minute. So you can there will be a timer, you can check there. Then you have to know, then you have to look for any use of the accessory muscles, any cyanosis, cease of breathing, sweating. Then what I say, we should ask them, do you have any cough? Then their entry, is it equal or unequal? Then the rhythm, any abnormal respiratory sounds like that, any stridor, wheezes, rattles, like that, you have to observe and you should inform them. Then next you have to check the blood pressure. In order for that, you should ask permission to minimally expose, and we should ask them which hand they want to check, and we should also look for any contraindication like AV fistula, cannula, and any infection, wound, rashes, like that we should check. Then make sure that nothing is there, so you can use it. Then you should inform them. You should explain all procedure to them, like that. We will apply the cuff 2 to 3 centimeter above the brachial artery, and during inflation there will be some tightness, but if you experience any other discomfort, just let me know, like that we should tell them. Then after that you have to check the pulse rate. That one also you will keep 2 fingers on the radial artery, that is on the wrist, and you will count the pulse rate for full 1 minute, and you will look the strength and rhythm. You should inform them. Then capillary refill you have to check. Then that is the, you should squeeze on the nail bed for 5 seconds and wait for another 3 seconds, and if the refill time is less than 2 seconds, that's normal, and observe for any pallor, like that. Next you have to ask for any pain, do you have any pain? Then also the urine output, how, when did the patient pass the urine, and how was the color, like that. And if there is any fluid chart, you can ask the assessor to check it. Then you should ask for the blood sugar. It is maybe the patient doesn't know, but you can ask the assessor what is the latest blood sugar, like that. They will tell it's normal or abnormal, like that only. They will not give any reading. Then next you can ask if do you have any bleeding, rashes, bruises on your body, like that you can ask. Then after that what you have to do, you should take time to calculate, write the vital signs in the news chart and calculate the score and explain them what is the score. If it's like 2, I will monitor you every 12 hours, like that, or every 6 hours, and for meantime, as long as it's a low score, for no need to escalate to the doctor, and if it's there is any changes, I will inform the doctor immediately, like that we can ask. Then we can ask about some physical, you there will be some symptoms they will provide, but you should ask some more questions to get any problem from them. Accordingly we can ask the questions here. Do you have any constipation or diarrhea? Do you have any mobility issues? Maybe it's mentioned that the patient is not eating for 3 days, like that. Then we should ask, do you have, how is your eating pattern? Then they are telling it's not, then we should ask them, what is the reason behind, why don't you eat? Is there any discount? Do you have any nausea, vomiting? There will be some reason, fever, loss of appetite, like that. We should find out the reason behind that. Then we should provide some health education, like you can eat small and frequent foods and try to increase the fluid intake, so your appetite will increase. Then I will escalate to the doctor so he can prescribe some medication, like that. Then for the constipation, you can advise them to have some fiber rich content diet and drink 2 to 3 liter of water fluid per day if they can tolerate. Then we will inform the doctor to prescribe some laxatives. Then we can ask them, do not hold the urge to pass stool, because if it in the hospital and all, they are not comfort to pass in this diaper or in the commode if they are not able to go to the toilet. So we should inform them. Then always provide privacy, like that we should. Then like that we have, if there any spiritual need like chaplain service they need, any counseling session they need, we should ask them or everything, and we accordingly we should give the health education. Then the sexually excoming patient is whether he is able to wear the clothes, they have their own clothes, or how is. Then what about the washing clothes, like that, cleaning, whether they need assistance. If they need some assistance, they can arrange some carer, like that. There needs to be met. After that, once you completed the week, you can ask them, do you have any more concerns? If whatever they are answering, we should write it at the back of this. There is a section we can write, because we need it for the handover session, that is the evaluation and planning, everything we need it. So it's very important to document. Then once it's complete, we can inform them my assessment is complete, and if you need any concern, if you have any concerns, you can use the call bell, like that. And then you don't forget to do the hand hygiene. This is all about the assessment station. So just wait for the planning, implementation stations and evaluation. So thank you for supporting. Keep watching. Bye.